Hello, J Mariah 001 here with you. It is the 19th of February 2016. It is 6:04 p.m. my time, and today I want to talk a little bit about anxiety disorders and the different kinds. I'm going to start off with panic disorder. I'm just going to read off a sheet here that I have in front of me. I don't have this memorized by any means, so if it sounds like I'm reading to you, I'm sorry, but that's because I am reading. Okay, approximately 3 to 4 out of every 100 people will suffer from panic disorder. The core feature of panic disorder is excessive fear of the bodily sensations associated with a panic attack. In panic disorder, the panic attacks occur unexpectedly when there is no real danger. They are not the result of a medical condition, and they do not reflect alcohol or drug intoxication. The onset of panic disorder can occur at any age, but is typically sometime between late adolescence and the mid-30s. The rate of panic disorder is higher among women in comparison to men, ratio of approximately 2 to 1. Many people with panic disorder experience their first panic attack when coping with stress or when experimenting with recreational drugs such as marijuana. People with panic disorder usually fear the panic attacks because they are concerned that something really terrible is happening to them. What if I am dying from a heart attack, stroke, or some kind of disease? What if I am going crazy or losing my mind? What if I lose control or do something dangerous? What if I lose control and do something embarrassing? Many people suffering from panic disorder seek medical treatment. For example, they go to the local emergency room, regular physician visits, or using ambulance services. Many people with panic disorder go through extensive medical tests, which typically fail to identify any significant medical problems as the underlying cause of the panic attacks. People with panic disorder often try to prevent or stop the panic attacks by escaping situations that trigger anxiety or panicky feelings, finding a place that feels safe, being with another person or a pet, avoiding situations, experiences, or things that trigger anxiety or panicky feelings, using medications or other substances, sometimes inappropriately or excessively. Many people with panic disorder also receive a diagnosis of agoraphobia. Other problems associated with panic disorder can include using alcohol or drugs in an attempt to reduce anxiety symptoms, missing work, and being on disability. Approximately 50 to 60% of individuals with panic disorder have problems with depression. For many of these individuals, depression is likely the result of living with panic disorder and its symptoms. Evidence-based treatments for panic disorder. Cognitive behavioral therapy, CBT, serotonin reuptake inhibitors like paroxetine and fluvoxamine, and then there's tricyclic antidepressants, and benzodiazepines. And that is panic disorder for you. Just a little bit of information for you there. Let's see. That's not really an anxiety disorder. That's just... Oh, here we go. Here's another anxiety disorder, social anxiety disorder. Recent studies suggest that social anxiety disorder is the most common anxiety disorder, with approximately 7 to 13 out of every 100 people suffering from this disorder at some point in their lifetime. Social anxiety disorder is just as likely to occur in men as in women, although the onset can occur at any time. Most people with social anxiety disorder first experience problems during early childhood or their teens. When describing social anxiety disorder, it is important to point out the difference between shyness versus social anxiety disorder. Shyness is feeling uncomfortable, anxious, or tense when talking with other people or when doing something in front of other people. Feeling shy in certain situations can be a normal and common experience. For example, when giving a talk in front of a group of people or when going on a date with a new person. For some people, the excessive shyness or social anxiety leads to significant problems such as social isolation, loneliness, unemployment, limited educational or career achievements, or avoiding important things, such as work-related activities, getting together with friends, or family. Social anxiety disorder is also associated with increased risk of substance abuse if people try to self-medicate their symptoms, for example, using alcohol to feel less inhibited in social situations. Main features. People with social anxiety disorder have one thing in common: excessive fear of embarrassment, humiliation, or being evaluated negatively by other people. Most people with social phobia describe a strong fear that they might do or say the wrong thing. For example, what if they think I'm an idiot or a loser? What if they don't like me? What if I make them mad at me? What if I go blank and can't think of the right thing? What if I tremble or shake and they notice? The common underlying concern is the fear that other people will reject them in some way for being incompetent. People with social anxiety disorder often experience a variety of physical symptoms of anxiety. For example, rapid heartbeat, sweating, blushing, trembling or shaking, or an urgent need to urinate. Sometimes it is these symptoms and the fear that others will notice and think negatively of them that becomes the focus for a person with social anxiety disorder. People with social anxiety disorder may fear only one specific social situation or a variety of social situations, such as public speaking, eating or drinking in front of other people, writing, working, playing while others are watching, making conversation, dating situations, parties, joining or leaving a social situation, interacting with an authority figure, or having to be assertive. Because social anxiety disorder can lead people to avoid social activities, some people with social anxiety disorder become socially isolated and lonely, which can be a risk factor for developing depression. Now, these evidence-based treatments for social anxiety disorder. Once again, here we have the cognitive behavioral therapy, CBT therapy. We have behavioral therapy. We have serotonin reuptake inhibitors. Monoamine oxidase inhibitors. Benzodiazepines. Beta blockers are not an evidence-based treatment for social phobia. So that was just some information on social anxiety disorder for you. And I hope you found that helpful. I certainly did when we learned about it in class. We read through the stuff in class. Now this next one is generalized anxiety disorder. Now, from time to time, all of us will find ourselves worrying about ourselves, someone we care about, or some kind of experience or event in our lives, especially if we are coping with stress. Worries typically involve fear that something bad may happen and the fear we may be unable to cope with future stressful experiences. Sometimes worries can be about real problems and how they are going to turn out. Sometimes worries can be about future or potential problems that may never actually happen. Now, excessive worry. For people with generalized anxiety disorder, it becomes very difficult to control their worries, even when their life is going relatively well. The frequency and intensity of worry, thoughts, and images is high, and the person worries about a variety of different areas rather than just one thing. Often the excessive worrying is associated with other disruptive and uncomfortable symptoms, including sleep disturbance, muscle tension, restlessness, being on edge, being easily fatigued, irritability, and difficulty concentrating. Other individuals complain of feeling shaky or twitchy, muscle soreness, cold, clammy hands, sweaty, dry mouth, nausea, diarrhea, urinary frequency, and exaggerated startle response, trouble swallowing, or a lump in the throat. Some people with GAD also have physical conditions associated with chronic stress, such as recurrent headaches or irritable bowel syndrome, while others struggle with substance use problems as they try to reduce the excessive worry and related symptoms with alcohol and/or drugs. Approximately 3 to 4 out of every 100 people currently meet criteria for GAD. GAD typically becomes a significant problem during the late teens or early 20s, but many people with GAD remember being anxious as children. The rates of GAD tend to be higher among the elderly, with as many as 7 out of every 100 elderly individuals suffering from symptoms. We also know that GAD seems to affect more women than men. People coping with lower socioeconomic status, such as lower incomes, poor housing, etc., are also more likely to have GAD, possibly due to a higher rate of life stressors that can make a person more vulnerable to uncontrollable worry. Worry themes. In general, people with GAD worry about the same things as people with normal levels of worry. However, people with GAD often worry about the worst-case scenario. For example, is my husband late home from work because he has been in a terrible car accident? What if my boss fires me, etc.? Common worry things include relationships, work or school, family or friends, pets, health issues, finances, community or world affairs, being late for appointments, getting tasks completed, or other daily hassles. Although all of us worry from time to time, people with GAD find it difficult to control their excessive worry. Excuse me. And it causes great distress and/or interferes with how they want to live their lives. Some people with GAD have positive beliefs about their worrying, which makes it difficult to give up. For example, worrying helps me solve problems. Worrying helps protect me from bad things. Worrying helps prepare me emotionally for when bad things happen. Worrying motivates me. Worrying makes me a caring person. Some people with GAD have negative beliefs about their worry. For example, worrying could give me cancer. Worrying could make me lose my mind. My worrying may cause the bad thing to happen. And that's the end of that one. And it doesn't say any medications or type of therapy to go through for that one. Must have cut it off on the information sheet here. But it doesn't say anything for that. And the next one I will do in the next video, because I've already been talking for long enough here to try to keep your attention. And I don't want to go overboard, so I won't go into the next one. The next one is post-traumatic stress disorder is the next one, but I will do that next time. Anyways, again, thank you for listening, and I hope you found that information helpful. And once again, I will do the post-traumatic stress disorder one next time. Alright. Once again, thank you for listening.